We're going to talk about my 3 favorite tools for back pain relief when you're experiencing a bout of sciatica or a back pain flare-up. And this might be one of my most helpful videos that I've made about this, so let's get right into it. The tools that we're going to talk about are a foam roll, preferably the firm kind, which are usually black in color. A bike ergometer, which you'll most likely find in a gym unless you happen to have one at home. And lastly, a pair of shoes, because I'm going to show you what I believe to be is the best technique for putting on your socks and shoes if you are in a back pain flare-up or are struggling with sciatica. So let's get right into it. The first tool we're going to talk about is the foam roll. There's lots of different ways to use a foam roll, and there's good ways and there's actually ways that can be harmful to you, which we'll talk about in a minute. But the most effective way that I believe that you can use a foam roll to help with back pain and sciatica is to use it with a parallel spine position. And just laying on the foam roll with your spine on the foam roll parallel to it is a great way to offload all of the tissues around your spine, which doesn't get to happen very often in most environments. So all of the tissues are unweighted and just the spine is being supported in this parallel position. Also, you can kind of move your body back side to side and get a little massage into those soft tissues. So just moving your body back and forth. And another thing you can do is you can do floor angels with your arms and just get those tissues moving underneath you and just getting some motion and into the tissues. Motion is lotion. So it's a great way to just relax all of the fascia and the muscles and everything else that is connected into your lumbar spine, and that can help to take pressure off of the discs and vertebrae and hopefully potentially the nerve by relaxing into that foam roll. And you can just take your time and breathe into it and just feel your body relax. That relaxation can actually allow your spine to lengthen a little bit, decompress, and just fall into a better alignment along that foam roll. And just adding the motion of the floor angels just adds even more elasticity in the tissues and encourages them to relax in different ranges of motion. So another way to use the foam roll is by using it for massage. So we already talked about kind of rolling side to side while in that parallel spine position, but you can also use it to massage your quads, which are a muscle group that tend to contribute to conditions like sciatica or stenosis. And so you can use this like an exercise where you're bracing your core throughout the process, but also massaging and relaxing this large muscle group that when it gets tight, pulls your pelvis into an anterior pelvic tilt and also puts tension on your lumbar spine. Another way to use the foam roll is by massaging your lats and your rib cage. This is beneficial because the lat muscles, while they don't directly control the lumbar spine, they attach into the thoracolumbar fascia, which spans across the entirety of your lower back and is highly influential in the tension of your lower back. And so if the lats are tight, they are increasing the tension in your lower back, potentially contributing to compression of the discs and vertebrae and potentially nerves as well. So by relaxing those lats, you can indirectly take tension off the lumbar spine through the thoracolumbar fascia. And this technique also gets some mobility into the rib cage. And improving the mobility in your rib cage is beneficial because it helps you to move through your thoracic spine. All of the ribs attach to the thoracic spine, and if the rib cage becomes stiff, which it tends to do, it stiffens up that entire portion of your spine, the thoracic spine. There are 12 vertebrae there. And if they're not moving very well because of stiffness, then all the movement has to go into the joints above and below, which happen to be your neck and your lower back. And these are the areas of your spine that tend to break down because of overuse and repetitive trauma. So getting more motion, more mobility into your rib cage and your thoracic spine is a very beneficial thing to take the load and the stress off your lower back and also your neck. If you want to add a challenge to this parallel spine foam roll position, you can, while keeping your core engaged, add some leg movements. And so you can start just with marching your legs. So this is allowing your spine to relax into a healthy position while engaging and training your core in a healthy way. And so you can start with some marches, see how that feels. Just go really light if you choose to do this. And if it feels good, you can start to progress and even maybe come up into a bridge off of the foam roll. And I would be careful not to bridge too high unless you feel really confident with your core engagement and your pelvic position. But for most people, I would recommend staying pretty low in the bridge. And if you want to learn more about that lumbopelvic control and stability, this is what we focus on in the core balance training program, where we do teach people how to bridge all the way up without hurting their back. And this does become one of the most beneficial exercises for relieving lower back pain and just getting out of the back pain cycle. So that is a way to add challenge, is just core engaged with leg movements. And by the time you get up from this, you should be feeling pretty good. Now, I mentioned there was one way that you should absolutely not use a foam roll for sciatica or most chronic back pain conditions for that matter, and that is rolling your lumbar spine directly on the foam roll. So that would be a perpendicular foam roll position to your spine and just putting all the pressure of your body weight on the foam roll and rolling on that lumbar spine. It's just too much pressure on some individual vertebrae and discs. That your body weight and that pressure has the potential to cause irritation and aggravation in the discs, and just put pressure on the vertebrae in a direction that is probably not beneficial for most people in chronic back pain, because it can increase things like stenosis. And if you want to roll your spine in this perpendicular foam roll position, I would recommend sticking to your thoracic spine, which is definitely a part of the spine that could benefit from increased mobility and reducing stiffness in that area. Another tool that can offer relief for sciatica or many back pain conditions is the bike ergometer, or even just a bike if you have one that has good ergonomics. And this is because the bike erg in particular is a safe, low impact way to just get your body moving and get your muscles and your blood flowing. And that can loosen up the tissues and release tension and just allow that motion is lotion concept to take its effect in your body. And so it is beneficial because of that reason. And then it doesn't have the potential negative impact that a lot of exercises have, which is the impact. And so this is just a low impact way, a healthy way to move your body and get some relief. And with the bike erg, it does involve your arms, so that allows you to get some upper body movement and really focus on that reciprocal motion that allows you to engage your core, which is the cross between your arms and your legs. And so this is more beneficial than a regular bike or just cycling where your arms are pretty static, and that can generate some stiffness in your arms and shoulders, and your legs are really just the things that are doing the movement. So the bike erg is versatile in the sense that you can do one arm, you can do no arms, You can switch arms, and that allows you to just get some different angles and types of mobility through your core and through your body. So this one, benefits are mostly for, cardiovascular, getting blood flowing, oxygen to the tissues, and it's low impact and potentially a way to just relax the muscles and maybe take some pressure or tension off of the vertebrae, the discs, and hopefully the nerve as well. Okay, so the last thing I wanted to talk about is the best way to put on your shoes or take off your shoes with a back pain flare-up like sciatica or just any kind of setback that is really restricting your movement. So the tools that you want to have are, well, in this case, I'm using a plyo box, but you can use anything that you can bring your foot up onto, like a bench or a stool or anything that allows you to elevate your foot, pretty significantly. And also a wall. So you want to be close to a wall so that you can put your arm or your hand up on it and support yourself, because that is going to be the key that takes the load off of your spine when you are putting your shoe on or taking it off. So you're using one hand to support your body up against the wall, and you're using your other hand to slip that shoe on. And when you go to tie your shoes, you definitely want to focus on hinging from your hips. You don't want to be bending at your spine or bending your lumbar spine or flexing your spine forward. The goal is to keep that core engaged and use your hips like a door hinge, because your glutes and your hip muscles are very strong and they can support your upper body and hinge at this hip joint, which is designed for much more for movement than your lumbar spine. And so for tying the shoes, you are going to most likely need both hands, but the putting on and taking off of the shoes, you can do this with one hand with your foot elevated up onto a box, and just takes a lot of pressure off the spine when compared to sitting and bending forward, bending down to put on your shoes and tie your shoes. That's a lot more pressure on the discs. So this is a much preferable method, and it may take a little bit of practice, but once you get the technique down, it is a very enjoyable way to put your socks and shoes on. So hopefully you find that helpful. And comment below if you have any favorites or if you tried any of the tips that we talked about today. And we will be back next week. So we talk about a different topic related to getting out of the back pain cycle for good every single week. And until then, make sure you get down on that floor and connect to your core. And if you don't know what that means, you can always check out the free trial of Core Balance Training and learn a healthy form of core engagement. All right, take care.